Opioid medications are a powerful and often necessary medication for treatment of moderate to severe restless legs syndrome. But why does it seem like most doctors won't prescribe them? I'm Dr. Andy Berkowski of ReLACS Health, and today I'm going to talk about 5 reasons why doctors may be hesitant or unwilling to prescribe opioids for this condition. Number 1, there is a risk of overdose and a risk of addiction. Opioids have potentially lethal side effects. If someone were to overdose on a certain amount of opioid, they could stop breathing and die. That's why we have the war on drugs. That's why there are so many opioid-related deaths. These are serious medications with serious risks, in addition to the fact that one could be taking opioids for a legitimate treatment and develop an addiction. So these are really concerns that should be looked at very closely. Number 2, there's a fear of lawsuits. So stemming from number 1, if something bad were to happen to a patient, a doctor is worried that their license could be at risk, or there could be a lawsuit against them, so they would rather avoid the potential risk. Number 3, the pendulum often swings too far from one direction to another. We used to prescribe opioids like candy at Halloween. Now they're completely evil and bad, and they're completely banned from treatment. Opioids are neither good nor bad. They are a medication treatment, and there are probably good uses for opioids. So the all or nothing, black or white thinking related to opioids could be one of the reasons why a doctor won't prescribe them. Number 4, it's a hassle. To prescribe opioids often involves drug testing, patient agreements, writing prescriptions once a month, checking the pharmacy database prior to each prescription, and then sometimes there are issues with the pharmacy and transferring the prescription. It's a lot of paperwork, a lot of hassle, a lot of phone calls, so some doctors just don't want to deal with that. And finally, number 5, sometimes just saying that doctors will not prescribe opioids is just an excuse to avoid these difficulties and challenges. So by saying opioids, I don't prescribe them, this is a way to hide behind a belief, almost like a religious belief, that I don't do this, don't come ask me about them. And unfortunately, for many conditions, particularly for restless leg syndrome, there are a subset of individuals in which opioids are both safe and effective and necessary. And some patients are needlessly suffering when they have this option available. Something to think about when it comes to opioid prescribing in restless legs. As always, this video is for general medical information only. It does not constitute the practice of medicine. All decisions around opioids, treatment of restless legs, or any other health condition should be done under the guidance of a licensed medical professional. And as I sometimes remember to say, one of the keys to sleeping well is to relax.